Wow, what a question. Semaglutide is one of these medicines that have changed, our life as humans. I would probably compare semaglutide with penicillin. Back in 1928, it made a big impact in humans' life. We were dying back then, because infection. Dr. Fleming came up, with this excellent idea, and, it makes a change. Semaglutide is well known for the weight loss properties, but it goes way beyond that. So, for example, if you look it up, is a mimicking gut hormone GLP-1. So at the level of the stomach, yeah, it makes you feel full earlier. So obviously your satiety, is earlier, and obviously you stop eating. But at the level of the brain, it kind of, stop, those sugar cravings. At the level of the liver and as well the pancreas, it mobilizes that fat stored. And at the level of the muscle, it causes glucose oxidation, which means it's breaking down all that glucose that you don't need in, stored in there. And obviously at the level of the kidneys, it help them in with something called natriuresis, which is actually eliminate a lot of sodium. At the level of the heart, greater contractility, and at the same time reducing the blood pressure. So if you see, it's more than just weight loss. It's so many other properties, and it's one of those medicines that, as penicillin, change our life. I think, anybody is right for the medicine. I think, anybody can have it, but if you ask me who specifically will benefit from this medicine, especially, that people that have these kind of a stubborn fat that they cannot get rid of it, this medicine will make a big difference on you. Another population is these people that have a really hectic life. That they don't have a lot of time to exercise. I'm not saying that these will substitute, your exercise. You should exercise, but you don't have to do it, like extensive hours. So it's a tool to help you lose weight, especially when you have that type of life. There's another population that are considering bariatric surgery and will like to avoid all the risk of the surgery and as well complication. This is a good choice for you as well. And then finally, people that perhaps are not candidate for the surgery and they have a super obesity, they are unhealthy. This is a good choice. These medications were designed to be used chronically. So I always ask my patients how much you would like to lose, and if you get to that goal, I would say continue the medicine at least until you get yourself, very comfortable on your lifestyle changes. Maintenance dosages, can varies. You can go from once weekly to once every 2 weeks, or perhaps once monthly. And if you feel comfortable with your lifestyle changes and you feel like the medicine is no longer needed, then obviously, you can stop the medicine. But I will give a little time before you stop it abruptly. Otherwise, the weight will bounce back. Absolutely not. Semaglutide is actually a tool. It won't substitute nothing. It's actually extremely important for your well-being, which exercise. Obviously, if you have one of those hectic lives that you cannot do much of exercise, you can reduce the amount of exercise, and semaglutide will be added on, to help maintain that weight. But no, is my recommendation. A lot of people might do it, but in my recommendation, I see it as a tool, not as a substitute. So Mounjaro is the tirzepatide. That's the name of the peptide. Once again, is weight loss medicine. It's the newest one in the market. It came out in 2021. Technically, is the first in class because besides working as a GLP-1 agonist, it has another peptide, which actually is amazing because the new peptide is called a glucose-dependent insulinotropic polypeptide. It's basically a new peptide that enhances the GLP-1, and by that, obviously, you have better results in your weight loss. And it's first in the class, like I just said, and it has shown in multiple of my patients better results. So it's like a choice. It's an amazing medicine. Once again, the side effects profile is actually very low, and we have it available here at our office too. I'll come over to my office, get a consultation with me. I'll explain the medicine in much more detail. And obviously, we can enroll you as soon as you come. With that consultation, there will be a set of labs that you need preceding your treatment. Please follow up Rois Medical Group. We have the link in the website. We'll be happy to help you.